Hey there, baseball fans! Today, we're delving into a topic that every player, coach, and fan needs to be aware of: the most common injuries in baseball. From tendonitis to torn labrums, we'll explore the challenges faced by athletes in this high-intensity sport. With a demanding schedule and rigorous gameplay, injuries are an unfortunate reality for baseball players, both at the professional and amateur levels. So, let's dive into the top 10 most common baseball injuries and gain a better understanding of how they impact the game. Number 10. Concussions and head injuries. Starting off our list with a serious and potentially dangerous injury: concussions and head injuries. With fast-paced pitches and hard-hit balls, players risk getting struck in the head. These incidents can lead to concussions, fractures, and facial injuries. The impact of a ball traveling at high speeds poses significant risks, and protective measures, such as facial covers on helmets, are becoming more prevalent to minimize these injuries. Number 9. Torn ACL. Torn ACLs are dreaded injuries in various sports, and baseball is no exception. Running the bases or making sudden movements can strain the knee and result in an ACL tear. Pitchers are also susceptible to this injury, particularly during the delivery motion. Recovery from a torn ACL often involves surgery and an extensive rehabilitation process to regain strength and mobility. Number 8. Wrist sprains and breaks. The wrists play a crucial role in baseball, especially during swings and throws. Improper form or impact with the ball can lead to wrist sprains or even fractures. Hitters swinging heavy bats and players getting hit by pitches are particularly vulnerable. Broken wrists can have a significant impact on a player's season, but with proper care and management, sprains can be treated effectively. Number 7. Rotator cuff injuries. The rotator cuff is a complex group of muscles and tendons in the shoulder that can suffer from overuse and wear. Baseball players, especially pitchers, are at risk of rotator cuff injuries due to the repetitive and strenuous throwing motion. Tendonitis and tears in the rotator cuff can result in discomfort, pain, and reduced performance. While some cases require surgery, physical therapy can also aid in recovery. Number 6. Ankle sprain. While ankle sprains are more common in sports like basketball or soccer, baseball players are not immune to them. Sliding into bases or uneven field surfaces can lead to ankle sprains. Although not as frequent as in other sports, these injuries can still affect players' performance, and recovery time can vary from a week to a month, depending on the severity. Number 5. Dead arm. Every player's nightmare, the dead arm, is an extreme fatigue in the throwing arm caused by overuse. This condition is prevalent in pitchers who push their limits or return to full throwing schedules after taking time off. Rest is the key to recovering from a dead arm, allowing the muscles to rejuvenate and regain their strength. Number 4. UCL injury. The UCL, or unilateral collateral ligament, injury is often associated with pitchers. This ligament, located inside the elbow, can become severely damaged and may require the famous Tommy John surgery for reconstruction. Recovery from this surgery takes time, and pitchers need to undergo a comprehensive rehabilitation process to regain their throwing abilities. Number 3. Torn labrum. Torn labrums primarily affect pitchers due to the extreme stress placed on the shoulder during their throwing motion. The labrum, a ring of cartilage in the shoulder, can suffer damage from repetitive motions. Surgical intervention is often necessary for repairing torn labrums, and the recovery process can be lengthy. Regaining form and strength is a gradual process that requires patience and dedication. Number 2. Tendonitis. Tendonitis is a common injury that can affect baseball players, particularly around the elbow or rotator cuff. Constant throwing puts stress on the wrist, hand, and shoulder muscles, leading to inflammation and stiffness. Proper rest, stretching, and muscle work are essential for healing tendonitis. Pitchers often undergo rest periods and gradually reintroduce throwing activities to recover from this nagging injury. Number 1. Oblique strains. At the top of our list, we have oblique strains, an injury frequently encountered in baseball. These strains occur in the core muscles responsible for rotation, making them prevalent among players who engage in hitting or pitching. Recovery time varies depending on the severity, ranging from a week for minor strains to several months for more severe cases. Rest, rehabilitation, and gradual return to activity are crucial for complete recovery. As we wrap up our exploration of the most common baseball injuries, it becomes evident that players face numerous physical challenges on the diamond. From oblique strains to concussions, the physical demands of the sport can take a toll on athletes' bodies. Understanding these injuries and implementing preventive measures, proper conditioning, and recovery protocols are essential for both players and teams. Stay tuned for more sports insights, and remember to prioritize safety and well-being on and off the field. Thanks for watching.